Today, we are diving into one of the most disruptive shifts in modern healthcare, the weight loss drug revolution. Globally, the anti-obesity drug market is on a warpath to $100 billion by 2030. And India, it's not just catching up, it's accelerating. According to FarmTrack, the Indian anti-obesity drug market has exploded, growing from just 133 crores in March 2021 to 576 crores in March 2025. That's nearly a near fourfold increase in just 5 years. Leading this charge is semaglutide, which has grown from just 11 crores in 2022 to dominating the market with 397 crores of value currently. Meanwhile, other weight loss drugs like dulaglutide and liraglutide are struggling to keep pace. And now, a powerful new contender is poised to reshape the landscape, the anti-obesity drug mounjaro by Eli Lilly. This latest entrant is being positioned as a next-generation therapy in the fight against diabetes and obesity. But with the hype comes hard questions, ones we cannot afford to ignore. What are the real risks of these drugs? What do these drugs truly mean for Indian patients, for doctors, and for the future of chronic disease care? And who gets access? Who gets left behind? And are we treating the disease or just medicating the symptoms of a broken lifestyle? Today, we have with us two leading experts, Dr. David Chandy, as well as Dr. Neeta Deshpande, to address all of your questions. Welcome to the show. Dr. David Chandy as well as Dr. Neeta Deshpande, thank you very much for joining in and speaking with us today. Well, let's start with the overall interest. And Dr. Deshpande, let's start with you. Since mounjaro has launched, what's the kind of queries as well as interest that you've seen from patients and from, say, a doctor's perspective?
Right. So we have had a lot of inquiries from patients who were earlier averse to using anti-obesity medication for weight loss have now suddenly started showing an interest and coming to us. And there is this injection. What are the side effects? Can we use it? So a lot of queries are coming in the last 1 or 2 months. I feel that, yes, the interest is good because it makes our life that much easier to counsel the patient, especially for those who need it. So yes, definitely the interest levels have gone up quite a lot, and even amongst the medical fraternity. Our other departments like the orthopedic department, the gynec department, girls with PCOS. So even our medical colleagues have got to know about this, obviously, and they have been coming and asking us to put their patients on this so that their disease is also resolved in a better manner.
Okay, so say you were getting 100 queries before, how many queries are you probably getting since the past month, 2 months?
I don't think we were getting even 100 queries before. We were almost getting no queries. And now we have a sudden splurge of queries coming in for weight loss drugs, online and offline both.
Well, Dr. Chandy, you work in the bustling city of Mumbai, right at the center of the city. So what has been your experience, say, in the past 2 months with the launch of mounjaro?
So, in fact, from the last 3 to 4 years itself, there have been a lot of patients who have been discussing this with us, but the availability was the big challenge. Now, the big difference is the availability. You get it in most of the pharmacies, most of the hospital, and the cost also is quite competitive. So, it is available, it is more reasonably priced. So, these are the two things that I've. So, every day we're getting at least 3 to 4 patients who are coming to us inquiring, can they take this drug, either for diabetes or for obesity.
Okay, so that's the key question then, Dr. Chandy. Who are you recommending or prescribing the drug to?
So there are two categories of patients. Either someone with diabetes who are on reasonable, maybe 3 or 4 groups of medicine, still their sugars are not controlled. We need to add a different group of medicine. In them, we consider second, if someone is very obese, that is, if their body mass index is above 30, and if they have some comorbidity, like they have some obstructive sleep apnea, that is, they're snoring a lot at night, or if they have a lot of knee pain, that is osteoarthritis, or if they have fatty liver. So these are the comorbidities or the diseases associated with obesity. So if we can get their weight down, you will get good relief in their sleep, in the damage to their liver. So in these two category of patients, we advocate that this can be used. but we need to rule out other existing things, like, so there are some contraindications, or in some group of patients, you can't use them. So once it is ruled out, then we go ahead and we counsel the patient about this group of drugs.
Okay, so what are these contraindications where you can't use the drug?
There's a rare type of thyroid malignancy called medullary thyroid carcinoma. And this was actually seen only in the rats and mice model. It has never been reported in humans who were taking this drug. But because all these medicines are first tested in animals, it is safer to avoid these drugs in this group of people. Second, if some people have some pancreas issue, like chronic pancreatitis or a recent pancreatitis issue, we avoid this drug. Third, obviously, if a person is very lean, you don't want to use this drug because even if the person has diabetes and if the person is lean, you start this drug, there would be further weight loss. So these are the conditions that we defer
Okay.
using this drug.
All right. Dr. Deshpande, same question to you. Who are the patients who you are prescribing it to? Is there a certain BMI category that you are looking at when it comes to this particular drug or these set of drugs that you're prescribing to your patients? What is the criteria?
Yeah, so the indication is BMI 27 with a comorbidity or BMI above 30 without any comorbidity. But having said that, it also is a lot of patient preference also. So I use it mostly in patients who have had multiple attempts at weight loss, regained the weight. These are the people who can't keep on doing this yo-yoing thing. So to support them and their efforts, this drug is very, very useful. So multiple times failures. Or if people are starting out, I mean, they've come to us with a BMI of 35, 38, those kind of patients, definitely they would need a support because only diet and exercise will really not be enough for them. And these are the patients that we use it for. So the cutoffs are 27 and 30 with comorbidity and without. But having said that, anyone who's had multiple attempts at weight loss with a variety of diets and exercise, these are the patients who I prescribe it for.
Well, I think that's 50% of the population, Dr. Deshpande. Everybody tries to go on a diet and then gets off it, and there's all this yo-yo which takes place. So then, does that mean that this is going to be that heavily prescribed a drug that, you don't have any kind of contraindications, you can take the drug, your weight loss diets have not been working for you, so why don't you try this weight loss drug? Is that the way we are going when it comes to these drugs?
Possibly, because obesity has become so rampant in the population, thanks to our bad environmental and leisure time activities. So, because of that, and the huge population that is looking for weight loss, and the weights going up every year from BMIs, it's so routine now to see BMIs of 30, 35, 40. Everyone is desperately trying to lose weight. And please remember that at the end of the day, diet, exercise, and lifestyle modification work very well. The question comes when it comes to maintenance of that lost weight. Because your homeostatic mechanisms take over, your biology takes over, your hunger starts to increase, your satiety starts to reduce, your metabolic rate goes down with diet and exercise. And that is why relapse is more the rule than the exception. And that's where the drug comes in. So the drug tries to break this homeostatic mechanism and helps in maintenance of weight loss. That is why it is being prescribed so heavily.
Okay. Well, Dr. Chandy, would you agree? Are we going down the route where it's probably becoming a more of a lifestyle drug? People who've struggled with weight loss, and there are lots of celebrities on social platforms who have lost a significant amount of weight, and that probably allows people to become more open to the drug as well. Do you think that that's the route that we're going down? It's becoming more of a lifestyle drug? Dr. Chandy?
So, gradually it's becoming more like a lifestyle drug because people are getting more aware of this and they're seeing this on the screen. So they are more open to discussion. But what's happening is now it's getting a bit blurry, like, whom to prescribe it and whom not to prescribe. Because sometimes we have patients, even with a borderline BMI who's coming and, insist. So there we usually counsel the patient that, they actually don't need it. Like how
Mm.
Neeta madam mentioned that it is the diet and exercise that will help in the long run. And we only have data in people who are on the heavier side, like BMI more than 27 or BMI more than 30. So it gets a bit blurred when you have too much of information on the media and people who don't need it also come and request for it.
Okay. But the other question then is that when you mention lifestyle, is this a magic drug? Do you just take that one injection once a week and then you miraculously lose weight despite your old lifestyle of, say, processed food, junk food, and lack of exercise? Or do you have to change your lifestyle along with the drug to lose weight? Dr. Chandy.
Very good question. So most of the patients spend a lot of time discussing this. So my take on this is like this. It's one third your food, one third exercise, and one third medicine. You can rely only on medicine, but there'll be two things that will occur if you only focus on medicine. You will lose weight, but along with your fat percentage that goes down, you will lose muscle mass. And you don't want to lose muscle mass. So it's important in the diet you have a good balanced diet, reasonable amount of protein, and you need to do some amount of weight training, some amount of aerobic exercise. The second thing is, if you can do these two things, a good diet, good exercise, you can manage with a reasonably moderate dose. But if you don't rely on diet and exercise, gradually what would happen is your dosage that is needed would gradually keep on going up. You would need then very high doses of this weight loss drug, and you are more prone then to side effects. So I counsel the patients, if you want a low dose or a moderate dose, then the diet and exercise are very important part of your treatment.
That's actually one of the side effects that I wanted to touch upon, and you did mention it: muscle loss, or that
Yeah.
gaunt look that people get because of the usage of the drug for a period of time, or sarcopenia, which is basically muscle loss across the body.
Yes.
How do you prevent it? Can it be prevented with resistance training, and to what extent? Dr. Chandy.
So what we have seen is, so because you're aware of this, we follow a policy of start low and go slow. So we start with a very low dose, and instead of building this dose quickly, we build up the doses very slow, and we encourage the patients to have a good protein diet and a good weight training with an, if possible, with a instructor, with a physical trainer. With this, we have seen very few patients actually develop this protein loss. And what we have done is most of the patients, we track them. We do a DEXA scan for body composition, and we check how much is their muscle mass, how much is their fat mass. And we track this every 6 months to see how they are doing. And usually the patients do well if they keep these 3 4 things in mind.
Okay. Is there a cultural element to that, Dr. Deshpande? Because, in India, we have a large number of the population which is vegetarian as well. So the protein intake might not be as much. And separately, maybe there could be some amount of resistance for some people to do resistance training as often in the gym. So are there any kind of cultural differences in an Indian population using mounjaro or any other weight loss drug as compared to the Western?
Yeah, cultural differences in terms of protein intake, yes, because for a largely vegetarian diet, and even people who do consume non-vegetarian, they do it like just once or twice a week, which is not enough. So a protein supplementation almost becomes mandatory. Because if you try to give all the protein by natural means through a vegetarian diet, it's not always possible without increasing the calories at the same time. And therefore, proteins, we do have to rely on good protein supplements. So that is very, very important. As far as resistance training is concerned, yes, going to the gym, doing it under a trainer, this is desirable. But I always like to tell my patients that you can do this at home. And resistance training can be done twice a week or even thrice a week, 20 minutes. So that's not really too much. You can learn it online and you can do weight training even at home. And that is a must. So cultural differences are there, but they can be surmounted provided the patient is willing to take protein supplements.
Well, Dr. Chandy, we've also heard of side effects which include gallbladder disease, pancreatitis, as well as, say, gastro issues, which a lot of patients face, nausea, vomiting. Give us a sense in terms of how serious these kind of side effects are. How much of it have you seen in your practice?
So nausea is the most common thing that we see. It's in tune of almost 10 to 20% of the patients whenever we start or whenever we step up the dose. So we prime the patient that avoid having anything spicy or avoid overeating. The stomach will tell you when it's full. and listen to your stomach. Don't overfeed yourself. The second thing is the intestines are more sensitive. So patients are more prone to food poisoning. So again, we tell the patients to avoid eating too much outside. The other side effects are a lot of burping that can be seen again in tune of 5 to 10% of patients. Gallstones are quite rare. I've seen only 1 or 2 patients with that. We have never had any patients of pancreatitis as of now. The most
Okay.
common things are this burping, the nausea issue, and loose motion.
Well, the other, side effect that I wanted to talk about and which you did mention was basically the thyroid issues. And there is a black box warning which comes on these drugs with regards to these thyroid issues. Dr. Deshpande, how serious is this particular side effect? Are you concerned about it? Does it stop you from prescribing the drug?
So we screen the patients very well and we judiciously avoid it if there has been a family history of medullary thyroid carcinoma or there's a syndrome called multiple endocrine neoplasia. So if these are there either in the patient or in the family, then we would avoid the drug. Or if there has been a pancreas issue where there's been pancreatitis or chronic calcific pancreatitis, we do not know the safety of use of this drug, but we avoid it in these individuals. But other than that, there is nothing else to be done in these situations. So we just look out for the history, ask for it. If that is there, we don't use it. So yes, the warning is there, but that's what it is. And it's pretty rare, actually. We don't find this particular, it's called MTC. So it's not really there in a big way, but we ask the history of that.
Okay. Well, Dr. Chandy, this particular drug has also been linked to retinal issues as well as an increase in heart rate as well by say 10 to 15 beats. So from that perspective, how serious are these side effects for weight loss drugs?
If you look at the study or the research done in the eye issue, it was mainly done in patients who had diabetes. So when they were started to get their sugars down, that is when they had seen this issue in the retina or the blood flow to the artery supplying the eye, which would get injured. So even in patients not on this drug, we know that if we rapidly control the person's sugar, it can sometimes cause problem in the eye or even in the nerve. So when you're starting this in a diabetic patient, we always do it gradually. Like I mentioned earlier, start low and go slow. It's not like you're running a 100-meter race. It's like a 42-kilometer marathon. So you have to build up the dose very gradually. That is when you can avoid the side effect. And it's very early stage. We need more information on this group of patients to analyze it in a more thorough manner. The second thing that you mentioned, that is, patients who are having the issue of fast heart rate. Over there, it is linked mainly to a bit of dehydration. So what happens is when you have less craving for food, people drink less water. And when you have less water, people tend to get dehydrated. So we always remind the person that even if you're not hungry, make sure you're having your 2.5 liters of water. If you're well hydrated, the chances of the heart rate going up are less.
Okay. All right. Well, Dr. Deshpande as well as Dr. Chandy, we've got a couple of viewer queries with regards to these weight loss drugs, considering the kind of interest that you've seen in it. So just want a couple of quick answers from you. Dr. Deshpande, I'll start with you. One of the questions is, will I put on weight after using the drug, after the drug course is over?
There's no such thing as a course. These are drugs which are meant to be given long term. But having said that, the doses can be reduced. So, yes, there is a chance that there will be a rebound weight gain. However, that can be mitigated by a good lifestyle program and perhaps giving rescue medication. After, if you've stopped it, you can restart it maybe at a smaller dose and keep it as a maintenance dose for a while.
Okay, so that is actually one of the key questions as well, which viewers do have, is how long does one take the drug, Dr. Deshpande?
So there is no recommendation for how long it needs to be taken, but it just says long term. And obesity being a chronic disease, there could be a chance that you might end up taking it for a few years. And there is data for up to 3 years in all of the studies that have been done and even perhaps beyond. So there is no specific guideline to say that it's a course or it can be taken for only this much amount of time. So we have to go need based, see how the patient is doing, see how the lifestyle modification is, try to reduce the dose, wean off the drug for a while, and wait and watch policy.
Okay, all right. So one can take it for up to a few years as well. Now, just talking about the side effects, queries have also come in about what are the early warning signs that patients should have when it comes to side effects? What is a red flag and what is an early warning sign? Dr. Deshpande.
Yeah, one of the red flags is for pancreatitis, where you have pain abdomen, maybe radiating to the back with or without vomiting, and it comes on suddenly. So, this is one of the warning signals where they should go to their healthcare professional and get tested for pancreatitis. Or if on their routine examination, when they keep going for follow ups, maybe there's a small little nodule on the thyroid, then that needs to be investigated. So these are some of the red flags that one should be looking out for, and these are the symptoms.
Okay. Dr. Chandy, impact on fertility?
So whenever weight comes down, it actions the fertility. So we had some patients who have been sent to us who are quite obese before they want to plan for a child. So whenever the weight goes down, their ovarian reserve improves. So whatever data we have, it's a good data, but there's no data during pregnancy. So if anyone is, planning pregnancy, immediately we don't start it. We at least want this drug to go in for around 6 to 12 months. And once we stop it, then we allow them permission to plan for pregnancy after, say, 2 to 3 months.
Okay. Depression and anxiety, Dr. Chandy?
So there's been some data from the West that, it can cause some depression, anxiety. But what we have seen is usually the patients who want these drugs are actually more motivated. They want to get the weight down. And we make sure that, we are constantly in touch with them and we keep a watch. If we see some features of anxiety or depression, then we reach out and we, ask them to meet a counselor so that the root cause is analyzed.
Okay, all right. And quickly, last question then, Dr. Deshpande as well as Dr. Chandy, from both of y'all. Will you prescribe the drug if the patient can manage without it? Dr. Deshpande.
It is very subjective and relative. So we would obviously try for weight loss without the drug initially, but most often relapses are very common. And when such things happen, and if the patient has already begun to get comorbid conditions, we would like to use it. So if we can do without the drug, yes, of course, we would like to do without the drug. But more often than not, they might need the drug.
Okay, and Dr. Chandy, what about cosmetic purposes of the drug?
So, it has not been analyzed, so I would stay away from it. It's something that comes a lot. Lots of patients come and ask this. So it's always safer to stay away from it.
Okay,
We
for
don't have the
cosmetic
data.
purposes.
Yes.
Okay, all right. And would you prescribe the drug, or would you first go for lifestyle changes?
So definitely first lifestyle changes, diet, exercise. If someone can't get it down and if there's some comorbidity or if their BMI is high, then definitely it's indicated. But say someone who has a normal BMI wants to improve it just for cosmetic reasons, I think it's too much. They may land up with too much side effects.
Okay, all right, Dr. Deshpande as well as Dr. Chandy, it's been a pleasure. Thank you very much for joining in and speaking with us. I'm sure this conversation is going to continue for the next couple of months and years as the market expands and as the interest grows. Thank you very much for joining in today.
Thank you.